Thank you for talking to us today about the Macmillan treatment summary. Can you tell me what it is and how it helps cancer patients?
The Cancer Care Treatment Summary will be one document for patients, GPs and secondary care teams to use, where all of the important information about a patient's cancer journey will be kept. So, for example, their diagnosis, their treatments, any potential side effects of those treatments, who to contact in an emergency, all of that important information will be in one document. Normally a patient with cancer would visit their oncologist and their oncologist would see them, make a plan for treatment, tell the patient the plan for treatment, give them lots and lots of leaflets and information and make sure they were really well informed, and then write a letter to the GP telling them what's going on. That would happen, but then if the patient went back to the oncologist for the next week for something else, there'd be another letter sent to the GP. And when they go for their treatment then somewhere else, they get another letter to the GP. So the GP will get a lot of correspondence about each individual episode of what's going on with that patient. And a lot of the information then can get lost in that big pile of correspondence, the actual important facts that you need, the diagnosis, the treatment plan, important contacts for the patient, what their treatment actually involves and what side effects and things to look out for. It can all get lost in that big pile of paperwork.
Well, one of my remits a couple of years ago was to set up a patient engagement forum within the Macmillan Primary Care Cancer Framework programs. It was really important for us to take some of our projects and our ideas over to a group of cancer patients and to see their thoughts and their ideas.
I'm 5 years post-transplant. And, you know, if I were to have some sort of health issue now and go and see my GP, I'd want them to be able to look and on the clinical system and see the treatment I had, the drugs I had, and to be able to go, oh, actually, what you're suffering from today is because you had cyclophosphamide 5 years ago, or you had this thing, or you had that thing.
The work with the treatment summary really started with Dr. Elise Lang and myself and a cancer nurse specialist in Velindre. Let's work together collaboratively and have a pilot to try and carry out treatment summaries in Velindre. We took the learning from that treatment summary and we thought we want to take this wider and work on a national treatment summary, because there was a lot of interest from secondary care clinicians wanting to know about the treatment summary, and so we realised there was an appetite for some standardisation.
So what we wanted to do was create one document, and we were really lucky to have quite keen teams in Swansea who wanted to pilot the treatment summary. They were really keen to see how that might work. So over the last few months then we've been working on how the template might look, what information is needed, working with the IT department in Swansea to try and get it electronic as well, because that was really important to us, that it could easily be emailed to patients, especially in the current scenario.
Colleagues have been working across health board boundaries. So for instance, treatment summary work is a very good example of that, because that has been contributed to by people from multiple health boards and has taken the best from various individual health boards and combined it. So you get something that's greater than the sum of its parts. Treatment summaries are a tool to try and condense that information and summarize it. And so it improves the care we can deliver to a patient, and it improves safety is the main thing.
We hopefully see a real improvement in the way that patients are seen by GPs, the way that information is handled, and get confidence from patients that their GPs know exactly what's going on.
It was very fulfilling to be involved in the programme, working with so many very capable and talented people on something that meant a lot to people and hopefully was going to make a significant impact on people's lives.